So when patients have come to the office to describe treatment options for their snoring issue and or sleep apnea issue, what we've done is really done a thorough evaluation as to their specific causes of it. As we have reviewed previously in other videos, there are 5 primary causes for snoring and sleep apnea: anatomical blockage of the nasal airway, enlargement of the tongue, a long vibratory floppy uvula, enlargement of the tonsils, and weight gain. Typically, the nose is the primary driver for snoring. It creates rapid and turbulent airflow as it goes through the blocked airway. A tongue may become enlarged in response to chronic mouth breathing. The uvula gets stretched and elongated also in response to the nasal restriction. Tonsils themselves, as present, also will continue to progressively enlarge and may develop tonsil stones as a secondary consequence of the blocked nose, and weight gain will happen over time as our sleep quality and metabolic functions have been disrupted. We focus on trying to initially make the nasal airway better. And in many patients, doing simple medical therapy to address inflammatory processes inside the nose may result in resolution of the snoring for the patient. And at that point, if that's occurred, allergy management based upon allergy tests can successfully preserve that result. If you have significant structural issues coupled with inflammatory issues such as chronic sinus infection that fail to resolve with appropriate medical therapy, we have options to do nasal procedures. And basically the procedures, 15-minute balloon sinuplasty procedures in the office done under IV sedation, take a crappy nose and make it into a great nose. Because to win, basically the nasal airway needs to be open. If we've been successful in resolving this issue and the snoring is still persistent, we know that other factors may need to be addressed. It might be improvement of the nasal airway and a few pounds down. It might be that we need to trim an excess or elongated uvula, which can be done as a simple office procedure, or techniques to address the tongue, such as an oral appliance or nasal pillow CPAP, positional therapies that reduce the probability the tongue falls into the airway. These are factors that we would review with the patient in detail. In rare occasions, still, tonsillectomy may be required to resolve the condition. So our focus is to figure out the why and address it appropriately, going from the least aggressive approach to things that are more aggressive only if needed.